Okay, so a brief couple GU disorders for pediatrics, basically answering a few questions. What is it? Why do we care? What treatment is needed? And what nursing care should we provide? The first one is bladder exstrophy. Here's a picture. It's when the bladder is actually on the outside of the abdomen. So kind of similar to the bowel being on the outside of the abdomen, your gastroschisis, the bladder is not covered by the abdominal wall. So usually this should occur around by the 12th week of gestation. Immediate surgery is required. We are most concerned, obviously, with infection or damage to the bladder. Immediately after birth, you want to cover the bladder with a sterile, non-adherent dressing. This is why a lot of times in delivery boxes or nurseries you will see saran wrap, so they can cover it until they can get to the non-adherent sterile dressing. But immediate surgery is required. Something else with GU disorders or any thing related to male or female parts for babies. Children become aware of gender differences by 3 to 6 years of age. So any repair that involves any of the genitals is encouraged by 6 to 15 months of age. So it's done and healed by the time the child becomes aware of gender differences. Next, hypospadias. It is when the urethra is actually on the ventral side of the penis, so the bottom side, and there's different locations as you can see here on the picture. If their urethra is on the top side or the dorsal side, then it's called an epispadias. Surgery will repair this, but not immediately because they need the penis to be a little bit larger before they repair. So after birth, actually, they will not do a circumcision on the newborn, so they can use that extra foreskin for the actual repair. Next is when the testes do not drop into the scrotal sac, so undescended testes. This is most common in your preterm babies. Term infants rarely have this, but it can be seen in term infants. Surgery is required in order to drop the testes into the scrotal sac, and sometimes if the child's older, they may give HCG to help with this. Testicular torsion. It's when the testicle hangs free from a vascular structure, so it can be twisted or whatnot, but whatever, the testes are hanging without a blood supply, so they basically die. Symptoms can be an enlarged testicle, sudden onset of pain, and immediate surgery is required. Hydrocele is a fluid collection in the scrotal sac. Symptoms are an enlarged scrotum, pain. A lot of times this will resolve on its own, but if it's still present after a year and without resolving, then they will do surgery. This right here is a picture of illumination, so you should, if you put a light next to the scrotal sac, it will illuminate through the fluid.